Hi, this is my second video. This is Linda talking to you from my back porch about my ACDF surgery tomorrow. Just got a call from the hospital, and I am scheduled for the first case in the morning. I have to be at the hospital at 5:30 at the crack of dawn so that they can start me on all the pre-op stuff, start an IV, start IV fluids, give me some sedation, get me all prepped and ready for me so I can meet with anesthesiology pre-op, talk about all the little quirks about me and anesthesia, the fact that I wake up nauseated as heck from anesthesia. So I usually get some extra medicine called Zofran, and that kind of solves the problem. Anyway, so 5:30 in the morning is the surgery, and I will be first case. As the time approaches for the surgery, I get more and more anxious. I went to kind of lunch with my daughter today. We had some coffee. I have been on a liquid diet since Tuesday because I know that anesthesia will slow everything down, and the more I have in my system, the worse it's going to be. I wish everybody who went for surgery did the same thing, because they end up being very constipated and very miserable because their tummies are all full and they can't go anywhere with it, and the anesthesia makes it even worse. So I've been on a liquid diet since Tuesday, and hopefully that will solve some of the problems with post-anesthesia constipation. Yay! What a wonderful thing to talk about. But it's a fact of life with surgery. I mean, I guess people don't think about that, but everything stops with anesthesia. Everything stops. It stops all of your smooth muscle function, and that's pretty much how you end up going to sleep and not feeling any pain, is that all of the nerves are put to sleep, and that includes the nerves in your belly. And if you have something in there, it's going to stop, and you're going to stay there until your belly wakes up, which is usually 3 days after surgery completely, before you pass gas and actually move everything. So my solution to that, and I've seen it happen too many times not to recognize it, is that you're going to be on a liquid diet, and then there's nothing in your belly to have to worry about. So tomorrow morning is the surgery. I am getting super anxious. The whole situation, is just, it's worrisome. But I'm looking past the surgery, really, is what I'm trying to do, so that I can realize that on the other side of the surgery is recovery. And it'll be better. I won't be having the continuous pain in my arm. I won't be at risk for paralysis. That's the big thing for me. This is my daughter and I were talking about this today. I think this will be my 6th surgery. When you consider that I've had a bladder suspension, a cholecystectomy, an appendectomy, a gastric bypass, and a bowel incarcerated bowel resection. So that's 5, plus this will be 6. And hopefully it'll be my last. I really don't relish going to surgery. This is not something that I wanted to do. I pretty much have to do this because I don't want to end up in a wheelchair. And the seriousness of this, it overwhelms me sometimes when I think about it. And I went to a class this morning at the hospital and saw some of my coworkers, and they're like, well, I said my surgery's tomorrow, and they said, are you coming back? And I said, probably not. I probably won't be at the bedside ever again, which makes me kind of sad in some ways, because it's what I've known for the past 30-odd years. Since I was 19, I worked as a nurse's aide, and then I worked in a mental health facility, and then I worked as a nurse, and no, back his attack, and then during nursing school, and then as a nurse. So it's really been my life. So it's going to be hard to adjust to not doing that, but at the same time, the bedside has changed so much in the last 5 years. It's really not a good place to be as a nurse. And I don't envy the kids who are coming out of school now and having to deal with the stuff that they have to deal with. Used to be, as a nurse, that you could educate patients and inform them about their surgeries and their disease process and help them through the process. But everybody Googles everything now, and they think they know everything, and they don't. So there's still a lot to be said for experience and seeing people go through this on a routine basis, and knowing that, yes, I know that everybody's different, and if I hear the words, I know my body, one more time, I think I'm going to scream, because the truth is, you don't know your body. You have no idea what your body does. If I were to ask you where your pancreas was, you probably couldn't tell me. Or what it does, you probably couldn't tell me. And that's college educated or not. I asked my daughter, who's an attorney, where her pancreas is and what it does, and she has no clue. So most people are not half as smart as they think they are about their body. Okay, that's my soapbox. As I said that in my first video, hospital's not a place I want to be as a patient. It's certainly not a place I want to be as a nurse anymore, and those are some of the reasons why. Regarding the surgery, my plan is to walk as soon as I'm able when I get back to my room, and then post a video letting you guys know that I'm alive and well. I'm kind of glad that I'm the first case. It stops me from sitting around thinking for hours and hours on end, and so the day will just progress beyond that. And but you'll let you guys know what's up. So from the back porch, this is Linda signing off. I'll see you guys tomorrow.